Hi, this is Dr. Jeffrey Rapaport from New Jersey, and I'm speaking to Victoria. Victoria has been a patient since '06, and she also happens to be a physician. She's very knowledgeable in acne scar treatment, so I want to ask her, the first question is, tell us what you've had done.
I came here for treatment of my severe acne scarring, and I also had cystic lesions before. And a friend of mine who used to work with Dr. Rapaport told me about him because previous treatments have not been successful, and I just got frustrated about it. But she told me about the new approach of treatment, which is called Fraxel. It's Fraxel.
That Fraxel laser.
Laser, yes.
Did you have anything to go along with the Fraxel laser, or you just had the Fraxel laser by itself?
I had the Fraxel laser by itself in the beginning, the first time.
Right.
But I had about 4 treatments, I think.
Okay.
And after that, after a hiatus of about a couple of months, or 6 months, I think.
Right.
You know, and then I came back. I said I wanted more treatment, and you had the CO2 and Fraxel combination.
Right, and I think we also did some subcision for you also?
The subcision, yes.
Okay. So I know that you're in the healthcare field. What would you tell a professional, or what would you tell people the actual feelings that you have after, the feelings that you had before the treatment, and how do you feel now?
Before the treatment, I was rather conscious about the way I looked, and being that I also teach, it is something that I think affected your confidence and your sense of well-being, being in front of people. But after my Fraxel surgery, and when my scars have gone down to more acceptable levels, I would say, I had gained more confidence. I am more outgoing, and I see more people than I used to be. I used to avoid functions because I didn't think I was, I looked presentable because of my scars and the lesions that I had. And I'm already past middle age, but I still had breakouts at that age. But after this treatment, I stopped having breakouts of acne or any acute lesions, no outcropping of comedones, doctor, yes? I didn't have that anymore.
Dr. Paz had severe acne, cystic acne, which was active, and we were able to quiet that down, and with the procedures, she's gotten 70–80%. It's very nice to see that she could get that much improvement. And what would you tell people who are thinking about doing treatments who have the severe acne like you had?
Oh, I would encourage it a lot. In fact, every time I see somebody with such lesions, I tell them all about it. And I have not, I don't hesitate in telling them my experience about having the scars that they have when I see them, and how it affected my general well-being, I'd say, and they could see that since my scars are not as extensive as it used to be.
Now, you had been to a bunch of different doctors who really said that they couldn't help you, isn't that correct?
Yes, that is. I had, I think, I had been seeing dermatologist since, it was 30 years ago. I had taken medications, I had taken injections on the face and all that. Nothing really helped. Nothing was as permanent as now, and it did not stop me from having an outbreak of lesions monthly then.
And what about the scarring? Did they say they could help you with the scarring?
No, the first thing that they asked me before was whether I could tolerate dermabrasions, which I said no, because I know how painful it was. So I'd rather have my scars than that. But with the new procedure, it was very effective, and I was very happy. I'm very happy. I'm still happy. I'm happy with it. and I'm trying to get Dr. Rapaport complete the treatment.
Well, she's still undergoing treatments. We're about 3/4 of the way there, considering where she started. And this is Dr. Jeffrey Rapaport interviewing Dr. Victoria. And we thank you for speaking to us, and thank you for paying attention. And have a good day. Bye-bye.